The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Hello, today on Meet the Doctor, you're listening to my interview with Dr. Dina Strachan. She's a board-certified dermatologist in New York City. Welcome to the podcast.
Thank you so much for having me.
So what part of the city are you in?
I'm in Manhattan in the Murray Hill neighborhood near Grand Central Station.
What do you like about the neighborhood?
I love that it's really convenient, that there's all sorts of transportation, even for people who don't live in the city. So people who live on Long Island can get to my office very easily on public transportation. Connecticut, we're near Grand Central, which has the subway and also the Long Island Railroad. And then we're not far from Penn Station as well. And of course, there are buses. So it's right in the heart of the city.
Okay, so how did you end up there in Manhattan?
Well, I am a native New Yorker. I was born in the state, but raised in the city. And I, did my high school outside of the city. I went away to a boarding school in Connecticut, and I went to college in Massachusetts, medical school in Connecticut, and then I went out to California to train. But, New York called me back home. That's
California
basically what
either
happened.
has that effect on people. They're like, I got to go back home, or they're like, I'm never leaving. It's one of the two.
I had a period when I thought I'd never leave, but then after a while I was like, I miss home. I felt like there were just certain things in New York that I wasn't getting, but I still love California.
Sure. Yeah, what's not to love, especially if you're just visiting. So, how long have you been in your own office, running your own business and really owning everything yourself?
Gosh, I've been doing that since 2003, and to be honest, I know many doctors have this fantasy or this goal of having their own practice, and that never was mine. I had wanted to be in academia, which I did for 4 years, but I was just finding it to be very corporate. It wasn't what I thought it was. Medicine was really changing in the early 2000s when I started practicing late 1990s, and
Mhm.
I wasn't finding what I wanted. And I never wanted to do private practice, but, I got a couple jobs just as I was thinking about, well, what do I wanna do now? And, I ended up deciding to open my own practice, not because that was a fantasy, but I just saw it as the only way I was going to get what I wanted in terms of having a work life that I enjoy and having things run the way I like them to run.
Dermatology, how has derm specifically changed since you started?
Wow. So, I would say that since I went into it, it's become a lot more cosmetic, and, there are a lot more people who aren't actual board-certified dermatologists in it, because there's a lot more, mid-level providers in dermatology now, and there's a lot more private equity. It's the goose that, was laying the golden eggs, so a lot of
Yeah.
people took interest in dermatology who aren't necessarily interested in dermatology. That's my
What
take.
do you think how what do people still not understand about the importance of seeing a dermatologist when something's going on with your skin?
Well, I think it's because, you can see the skin yourself and it seems like it's low stakes. So I think there's a temptation to do it yourself a lot. Um, I would say that I didn't even understand what dermatologists did when I was a medical student. And I remember when I first got interested in dermatology, it was one of my friends from college who was a couple of years ahead of me in medical school who was so excited to having made the decision to go into dermatology. And I thought to myself, dermatology, how boring. How can because I didn't really know
Yeah.
anything about it. And, I was originally an AIDS dermatologist because I was in school in the 90s during the kind of height of all of that. And a lot of those patients had skin problems. So that's actually what started to draw me into dermatology. I was so impressed that the dermatologists that some of the other people made fun of would come in and solve the problems that the other doctors could not. They had such specialized knowledge.
What a time to be
Mm.
figuring things out and helping people.
Yeah,
And
yeah,
such a unique experience for you. Um, do you remember
definitely.
anything about that time period in your career that propelled you into the future in a way that maybe others didn't?
Being interested in HIV and dermatology seemed kind of odd. You know what I mean? That's not what people thought of as derms going into dermatology to do the hard things. And, I
Mhm.
just think that, taking on challenges makes you better at what you do, whatever it is that you decide to do. So, I just feel like it helped engage my mind, which likes to solve puzzles and solve problems.
Have you ever thought about writing a book about it?
Uh, I haven't thought about writing a book about that, but that would be an interesting book. I've written a book about just running a practice, called
Oh, you
Moxie
have written a
Mindset.
book.
Yeah, yeah, that was just for doctors, but, it's kind of a workbook just to get yourself in that mindset to make that transition from being a, doctor to a doctor business owner, which is it's a transition because a lot of what we, are selected for in medicine doesn't encourage us to be good business owners or to be business owners. It kind of actually can undermine our confidence, and actually doctors can be great at business. If we can learn medicine, we can learn business.
I might sum that whole statement up by saying it's important to know what you don't know.
Yes. Yes.
When do you think that aesthetics really started to take hold for you?
I would say for me in when I was in private practice
Mhm.
and, I was a little reluctant at first because, my intention, as a doctor is about the patient, helping people. And it's not that I don't feel like aesthetics helps people, but I know that it often would attract an energy where people were interested in it just for money. And I had a patient really humble me um, because she had gone to get a chemical peel somewhere and had gotten a complication, and she came to me with it.
Oh,
And
no.
I said, "Well, why would you go to that type of place, where people aren't as expert to do that procedure?" And she says, "Do you do it?" But I wasn't really offering it yet in my practice. I was more of a medical practice. And I said, "Well, I don't really do it." She goes, "But but you would do it better." I said, "Well, I know how to do it." She says, "Well, if you would do it better and you wouldn't offer it to me to do, then where should I go?" And I realized, wow, that was my stuff, and that actually I was helping her by actually providing the cosmetic service.
She was gonna go somewhere,
Yeah, she was gonna
and
go
she
somewhere
ended
to
up
get
getting
it.
hurt.
Yeah, yeah. So then I started to add it more and sort of get over how I felt about that.
What kinds of things did you start out with?
Oh, chemical peels, because it was so obvious, that that would be helpful for the patients I was already seeing. I had so many acne patients with hyperpigmentation, and they really, benefited so much from the chemical peels. I mean, chemical peels built my practice, really. When Botox was FDA approved and came out, it was popular, but I had a relatively young practice, so I didn't understand how people were doing all this Botox because I didn't seem to have anybody who needed it at the time, and so I had such a young practice.
Today, Allergan would say they all need it.
Yeah, well, young people still do it. They do.
They need Do
Pe
they need
people
it?
well, that's a that's a personal decision. That's a
It
personal
is.
opinion. But yeah, I mean, there's so many more things now that you can do for people. There's so many more devices. There's so many more opportunities to help people cosmetically. So
Mhm.
it's just easy. And then there's demand and awareness.
So as you built out that menu, what did you add next?
Well, I probably added Botox. I got some
Yeah.
patients who were a little had some wrinkles to treat, and fillers, and devices. I started with hair removal device, some lasers, some laser resurfacing, different things. Right now, RF microneedling is very popular in the practice as it has so many great applications and it's so effective. I'd say it's the most popular procedure I do on men.
Mhm.
Um, it people like it. I haven't had anyone who didn't like it, even though it's a longer appointment, but they like that very much. And then we have hair restoration in the practice. I have a big hair loss practice, and that developed over time organically before it was popular to treat hair loss. I just went to a program that trained us really well in hair loss. So to me, it was just regular dermatology. And when I went into private practice, I learned that not every program trained people as well in hair loss. And so I would have these patients come in who had what seemed like pretty straightforward problems to me, who claimed that they had gone to see many people. And
Mhm.
I couldn't believe it, but my patients made me a hair loss expert. So that is how my practice grew to have so many hair loss patients.
And what does your approach to treating hair loss look like?
Well, I treat it like I would treat any other medical problem. First of all, you get a diagnosis because there's so many different types of hair loss. So I'd say my approach is we determine what it is, and we don't hair loss and alopecia are the same word. So people say, "Oh, I have alopecia." And I'm like, "Well, yes, you have hair loss. You knew that. You knew that before you came to see me because that's why you came in." Um, but they're different types. So we determine what type and then we start treating. I'd say that, hair loss is getting really popular now because again, more and more technology, medications, options are available now. But as that happens, patients have to be more careful to make sure that they're not just picking up something for hair loss when they might have lupus, and that's what they need to treat. Or they might have scarring hair loss that's not going to respond or is going to progress if they don't treat it properly, if they don't get the right diagnosis, and they'll get permanent balding.
Mhm.
Or they have a thyroid disorder, or, you know, I've diagnosed people with syphilis, even, things like that, who came in with the complaint of hair loss. So it's very important to understand that hair loss isn't just this, that people think of androgenetic alopecia or the hair
Yeah.
loss that kind of just runs in the family. There's a lot more to it than that.
I think this also highlights why you can't just go anywhere or to anyone that says they can treat hair loss, that you should actually see a real doctor. And one of the funny things, I always laugh at my own stupid assumptions, and I've gotten better at not making those as I've gotten older, but, you know, um, I had no idea that dermatologists were the primary
Mm.
people who treat nails and hair along with skin. Like, I think most people just assume it's skin, but you're also the experts in hair and nails.
Yes, skin, hair, and nails, that's dermatology.
Mhm. Yeah, who knew?
I didn't
Um,
know until I went into it, so,
yeah, I
don't
mean,
feel bad.
if your hair's falling out, a dermatologist is a great starting point for what is happening to me.
Exactly, and there isn't just one blood test or one thyroid test. So, here's an example. I get a lot of referrals from primary care doctors for hair loss for patients who have hair loss, and they may have checked, routine labs like TSH, which is the thyroid stimulating hormone, which is like a general screening test for your
Mhm.
thyroid. But that can be perfectly normal. The patients will come in and say, "I've had every test, everything's normal." You know, we don't know what's going on, but actually you would check different thyroid tests if you were concerned about hair loss. So I check autoantibodies, and many times those are elevated and the TSH is normal. The regular thyroid test is normal, but those other ones will be abnormal because they're having some type of inflammatory event in their body that's making their hair loss not necessarily affecting their thyroid yet.
How do you go about treating that then?
Well, I send them back, and that's what they have to kind of manage with either, a rheumatologist, depending on what it is, or an
Yeah.
endocrinologist. But it just tells you that something is about to happen.
Yeah.
There's
Are
smoke.
there types of hair loss that can actually be treated and then your hair could grow back?
Oh, absolutely.
Yeah.
Absolutely. And with the new technology we have available, like right now, I have an Alma TED device, which is a hair restoration device, which is a great alternative to PRP because there's no blood, no needles, no pain. And it's very consistent. And I use that a lot off label. It's FDA cleared for male and female pattern hair loss, which is the genetic type that's not scarring, meaning that the
Mhm.
hair follicle hasn't been destroyed or scarred up. But even in a lot of my patients who have scarring hair loss, I've gotten excellent results with the Alma TED because it's kind of rescuing the hair follicles that are damaged but not dead, which might otherwise not produce a hair, or it makes them produce a higher quality hair. Because sometimes you'll see that the person, it looks bald, and then you look with a dermatoscope or a magnifying glass and they have really fine hairs, but cosmetically, it's not doing enough because if you can't just see the hair, does it matter that it's there? You wanna make it thick enough so that it looks like they have hair, and so with those types of treatments, sometimes we can get the hair follicle that's not dead to make a nice thicker hair that you can see with the naked eye.
If you think you're losing your hair, what is the very first thing you should do?
I would see a board certified dermatologist to determine whether or not you are losing it. I mean, sometimes people come in and they're not actually shedding hair from their scalp, but it's breaking, and
Mhm.
they can change their grooming routines and their grooming products, and that can change.
So we might be doing something to ourselves to cause the
Exactly.
problem. Yeah.
Heat, your hair could get dried out. If you color your hair or you change the texture of your hair, that can damage your hair. It always damages your hair a little bit, and then your hair is more likely to break.
Before we started recording, you told me if you could have been anything else other than a doctor, you'd have been a detective. But you sound to me like you're the hair loss detective.
I am a detective. I'm just applying it differently. But yes, I admit I love true crime.
You just lit up. Is the thing that you love the sort of the mystery and solving the mystery of what is going on with somebody's skin, hair, or nails? Like, you get to do that over and over.
I do. I do. I love that. I love mysteries. And, again, I thought I was going to be a psychiatrist when I went into medicine. Um,
Mhm.
and I love anthropology. I would read anthropology books as a child for fun, because I kind of understanding the mystery of people and what makes them tick. And in crime, true crime, you're kind of
Yeah,
trying to
you
figure out
are.
like what would motivate somebody to do that, and how did that happen? How did they miss that? And it's the same in medicine, and I feel like derm gives you a lot of opportunity to do that because I'd say it's one of the few specialties where you kinda get to use everything. You get to use your brain, you get to use your hands. You could run, derm in like a vacuum because you can see the patients, you can do a biopsy, which is a surgical procedure. In some states, and we get training on this, you can read the slides if you need to do a slide, you can read it yourself, and, you can do the surgery. So you can do a lot as a dermatologist.
So also good for people who are fiercely independent?
Yes, it is, it is.
When did you know that you wanted to be a doctor?
It was always something that was on the list. As a child, I wanted to be like an artist. My mom was a doctor, so, yeah, I'll be a doctor, lots of things, but I wanted to be an artist, I wanted to be a filmmaker. When I wrote away to get my, applications, because 'cause I'm from back in the day when you had to request them and they'd arrive in the mail. Um,
Mhm.
I actually sent for anthropology graduate school and film school applications as well, but I only sent in the medical school ones.
Oh, man, do you remember that feeling of, like, mailing something super important?
Oh, yes.
It felt totally different than like fill out this online form.
Yeah, I think you put a little more thought into what you were doing because of the friction, because you had to invest time to make the request, to receive it, to fill it out versus, just blanket applications that are very easy. I'd say one disadvantage of the easy applications is that I feel like people apply for things that they haven't really thought about as much.
Yeah.
That's what I'm noticing,
Yeah.
which is a shame because I think that, especially when it's something like, your career, your education, you're investing a lot of your time, your money. And so you want to think about why you're doing that. But I do remember I was living in Boston when I applied to medical school, and I just waited until the last minute for an application. It might have been for the medical school I went to, Yale. Um, I had to go get it sent overnight, and so I had to find out the times of, like, a, overnight delivery box, and it
Mhm.
was at Logan Airport, and so, there's
Mm.
a dramatic mad dash to the airport, to that box in Logan Airport that would get my application in on time.
And change your life forever.
Their last
Which it
pickup.
did.
Yeah.
Let's bring it back. Are you well known for treating hair loss in New York City now? And, do people call you to be an expert in that topic?
All the time. I mean, I do,
Yeah.
a lot of, media. So, I do a lot of media queries on hair loss. People approach me about hair loss products, hair loss projects, hair loss technology. I have done, uh, brand ambassador work with different hair companies. So that's definitely one of my things. It's not the only thing I do, but it's a definitely a big part of my practice. And I noticed that so many people had hair loss before I was a hair loss expert. It People come in for a wart and they leave with the diagnosis of hair loss as well. Because it becomes, by the way,
Because you can't help yourself?
well, I do a skin check on someone. I mean, some of the people I've
Oh, sure.
helped the most
Yeah.
had already decided that there was nothing they could do. That's when it feels so good. So we're just doing a routine skin exam, and I notice this hair loss, often a scarring hair loss, and I say, "Well, how long have you had that? And are you treating it?" And they're like, they might be wearing a wig, and they say, "There's something I can do?" And I've said, "Yeah, there are lots of things you can do." And
And
those
it's
that's, like,
almost like
life-changing. They didn't even come in
it's
for
right there at the surface, like, they are sort of continuously wishing there was something you could do, I don't think that
Yeah.
ever goes away.
No, no, no. I mean, I even have social friends that didn't
Mhm,
realize I did that, and then it would come up that I do that, and then, and I'm seeing them, and I didn't realize because 'cause I'm not examining them, they have it well
mhm.
camouflaged that they have the problem that, and I tell them if they are able to come and see me, or if they wanna go see someone else or somewhere where they live, because it may not be possible to be seen in New York, that they can get help. Ask for help. You have this. I mean,
Yeah.
that's one of the fun things about being a dermatologist. People always wanna talk about it, which
Does it bother you or you're fine with it?
I'm fine with it. I mean, of course, in
Yeah.
context, if we're on the train and you bump into me, there's HIPAA. We don't discuss we have
Yeah.
I have my white coat on now. I'm being the doctor, Dr. Dina. When it's off and we're in the street, we can have a conversation, but I often send people, to the office because you don't
Yeah.
wanna practice medicine, you know, over dinner or at a cocktail party. People have to treat the problems they have with respect.
What kinds of media appearances have been your favorites? Is there a show that you have been on or a story or something?
I'd say the most fun one was being in a Netflix docuseries, and I got to walk the red carpet in Hollywood. That was fun.
What series was that?
It's called The Black Beauty Effect. It is a docuseries about the history of, the impact of Black women on the beauty industry.
So what was it like walking the red carpet?
Oh, it was fun. It was fun. Um went out to LA and invited some of my friends, and it was just a nice experience to have. And it just, I mean, it made me feel it was like a different kind of honor that, like, I was just here practicing, taking care of people, trying to do a good job for them,
Mhm.
and that it was appreciated, and it was like appreciated someone wanted to codify it in a docu-series.
Did you have to have somebody help you get, find what to wear and all the things, like hair and makeup, and did you get to do all that too?
Oh, yeah. Yeah,
Yeah.
I it was out in LA, and I ordered a dress that I brought with me, and then I had somebody from one of those mobile glam squads come over to my friend's house that I was staying with
That's
and do my
such an
makeup.
LA thing.
Yes. When in LA.
Yep.
When in LA. So that was fun.
You told me also, there's a fun fact about you that most people don't know.
That I've been to all 50 states.
You have. Was that a goal that you set out and then you like started going on trips? How'd that happen?
Well, it's funny how I decided to do it. It wasn't a goal, but I was watching it was in 2016, I was watching the presidential campaign, and I just thought to myself, "Why do only presidential candidates get to go to all 50 states?" I thought they went to all 50 states, but they did
I think
not,
they
but
skipped some.
they skipped some, but I thought, "Well, I could do that. I should do that as well." And then when I counted the states I hadn't been to, I realized I'd only missed 16 and that it was quite doable. And so
Totally.
I set out to do it. And it actually, I feel like as a New York City doctor, people come from all over the country who live here. So it's
Mhm.
kind of cool when, there's the new patient, the new kid in town, bright eyes in the big city, and they come to their doctor for the first time, and they're from some place where they think no one's heard of. And I've actually been there, you
That is
know?
fun. Yeah.
Yeah. So it's a way of connecting with people.
So were the 16 like just like the least interesting states and you had to go there or how did you do that?
Oh, it was kind of embarrassing because when I moved from the East Coast out to California, I became acquainted with this term, the flyover states. I hadn't
Mhm.
heard that term before, and I thought, "Oh, what a horrible thing to say." You know what I mean? And then when I counted the states that I hadn't been to, it had been the flyover states.
So it was like what, Oklahoma, Kansas, Indiana,
Yeah,
Illinois. You've
exactly.
been to Illinois, I'm
I've
sure.
been to Illinois because we have we used to have to physically go to, like,
Uh,
the headquarters area, and I think for a lot of medical specialties because Illinois is kind of in the middle, um, things are headquartered there, so we had to go there to take our boards back in the
Yep.
old days, and, I'd been to some places in the Midwest just for social reasons or, maybe there was a conference or a course I went to, but most of them were the Midwest and mountain states. And it's not
Mhm.
that there wasn't anything attractive about those states, it just there wasn't I didn't have a reason to go. And I'd never driven
They don't
across.
hold dermatology conferences in those states very often.
Yeah, yeah,
Yeah.
yeah,
Yep,
but it
that
was
happens.
fun.
You drove?
Oh, I mostly flew to places and then maybe I'd drive. So the
Yeah.
first trip I did, I flew to Wisconsin and went to the Harley Davidson Museum because I had
Mhm.
rules. I had to go to someplace iconic, a state capital, um, someplace kitsch, but that was like really representative
Now,
of.
what does it say about you that you chose the Harley Davidson Museum and not the Kohler, Plumbing and Toilet Museum in Wisconsin?
I didn't know it was there. That's what it says.
Oh, now
Look,
you're
that
gonna have to go back. It's
I have to go
amazing.
back because that does sound amazing. But the
Yeah.
Harley Davidson Museum was amazing, and fun fact is that motorcycles used to be a gentleman's sport, not a bad boy sport.
Huh.
I learned that at the Harley Davidson Museum.
That's really interesting.
Yeah.
Okay, so you went Wisconsin, and then where did you go?
I drove to Iowa, and it turns out I had 2
Mm.
friends in Iowa.
Mhm. You didn't
And
know that you had friends in
well,
Iowa?
one of them I knew was there, but then another one who was literally moving there the weekend I went. So I went to stay with the one friend
Uh-huh.
who had recently moved there, and then the other one was moving there. And then, the big deal for me that trip was to go to South Dakota
Yep.
because I thought I was just gonna pass through South Dakota, but then I saw pictures of Badlands National Park,
Oh,
which was
yeah.
so beautiful, and, I stayed there for, like, 3 or 4 days in South Dakota because it was just so gorgeous, and there was just so much history there.
Mhm. It's wonderful. I'm so thrilled that you did that. I'm from Minnesota, so I I
I've been to Minnesota.
I approve your flyover state trip. I approve this message.
Yes,
There's so much beauty and it just so many interesting things to do and see and people. Yeah.
it's true.
Mhm. And a lot of kids who want to move to New York City and chase their dreams, who go and then go right back home.
Yeah. It's different. I mean, it's a different vibe. Like, I could see
Yeah.
how so much of many of the rock stars came from the Midwest because you have that space to develop you, and then you go to the coast to kind of sell it, but
Mhm.
you don't have all the noise competing. Do you know what I mean? There's an advantage there that you can just work on your own craft. You can work on yourself.
Yep. It's very good observation. How do patients find you?
They find me all kinds of ways. I mean, the word of mouth, referred by their doctor, on the internet. I had a website pretty early in my practice. So I think that's why when I started out, my patients were all so young. And so, all different sorts of ways.
What is it like coming to see you for the first time? Can you kinda take us through that experience?
Well, we try to incorporate useful technology as much as possible to make an efficient experience. So I'd say that what we like to deliver in my office is effective, efficient, elegant care. And some people say that comparing it to the airport is not a good analogy, but I like that. My dad was a aviation instructor, and
Mhm.
that kind of like regimen checklist that yes, everyone wants individualized care, but there's certain things that have to happen, right? In this process. So, we make the appointment for people, we verify their insurance, we take insurance, and then we send them digitally intake information. So instead of people sitting in the office for 15 minutes filling out papers, it's all done. So now when they walk in, there's just a little bit like show us their insurance cards if they haven't already sent that, and then we can see them very quickly.
Mhm.
And I tend to be a very results oriented doctor focused on solving the problem for people. So I tend to be fast. I actually wrote an article for Kevin MD. I don't apologize for being a fast doctor. That was actually one of their top 10 articles in 2016. And
Oh, cool.
it's the idea of I did all the work already. If it were an app and it were fast, we'd say yay. If it's me and I'm fast, we should say yay because you didn't come to waste your time on earth. You didn't people have things to do. They have their jobs to get back to, their families to get back to. Um and
Yeah.
so we try to solve your problem the first time. People might think it's more complicated to come to a specialist. It's actually easier. If someone knows what you have
Mhm.
the first time, you don't get 3 biopsies. Vice
That's a
from
nice
someone who
benefit.
doesn't know. Yeah,
Right.
exactly.
It's interesting. In one of my jobs, I surveyed patients for about 5 years. That was all we did. And I learned that, people don't like being rushed, but they also don't like waiting, and that the amount they don't like those 2 things is equal. And I spent a lot of time thinking about this. We like things to be fast, but when we're rushed because we're not being heard, that's what we don't like.
Yes.
Getting the answer fast is not what we're complaining about when we say, that I was rushed. Um, so how do you kind of balance giving your patients time to talk and be heard with being fast?
Well, I'd say I try to figure out what's going on, and
Hmm.
then, it just depends on how much somebody needs to be heard, right? Because we're
Yeah.
living in a time now where people spend a lot of time on social media, and a lot of times they wanna talk and talk and talk, but it's not helping them. No, honestly, and so
Hmm.
I see myself and my staff, we talk about this, it's a way of, like, shepherding, corralling us back, getting us back on
Yeah.
track. Because it's different. It's different than when I started. I wanted to be a therapist when I, started, and therapy is much more popular now, so this kind of idea of engaging every situation like you're in that situation of during therapy, but it's not always good to do that in every situation. Sometimes things are just straightforward, right?
Hmm.
And so you wanna keep them straightforward. It actually makes things makes it harder to get you help, and it can make it more expensive for you if you want things to be dramatic and complicated when
No
they don't have
thanks.
to be.
Right.
You know
That's
what I
right.
mean? I don't expect I've taken care of people in the ICU, and I worked in the hospital, very sick patients. That's how I started my career. So I know how to spend time, the right time with people who need that kind of time, who require that. But if you have one wart, but have a lot of feelings about it, I may not spend as much time with you as I do with the person whose skin is blistering off.
Let's be realistic.
But
Yeah.
this is just the truth. I mean, people's sort of
Yes.
expectations, they sometimes the person who's concerned about that, maybe you don't need that to be heard that way from your doctor. Maybe you need to do more social things. That's one of the things I talked about in my article because I was noticing it as a doctor in a very social job that the people who would complain about not getting enough time from me got the most time from me.
Are they lonely?
I thought in some cases that might be the case, but
Yeah.
also it was before, people were starting to work from home, order everything on apps, interact on a phone, not interact with people. Um, and so when you stop interacting with people, the doctor, I can't make up for that loss of social contact. And so that's one of the things I was able to observe. I guess that's on my anthropology brain. That's why that
Hmm.
article was very popular that year. I'm here. I'm just your dermatologist. I treated your wart. It's fine. We treated you well with respect, but I can't make up for the fact that you don't talk to people, that you don't socialize. I can't, there's nothing I can do to compensate for that, nor should I, because that's not my job. You should go socialize with people. That's,
I
I
just
think in
got
all services, because I feel like
What About
too.
Bob is what popped into my head. How
Oh,
many
what is
times did
that?
I watch
Is
What
it,
About Bob, the
oh,
movie?
I don't know that movie.
Are you kidding?
I'm
Really?
surprised. I'm such a film
Oh,
nerd.
no. Okay. Bill Murray, is like a hypochondriac, and he drives his doctor crazy because he needs him too much.
Okay.
Okay, so I know what you're doing tonight. It's your assignment is that you have to watch What
What
About
about
Bob?
Bob on it? No, I'm surprised I have not seen that. I used to run film societies in college and medical school. So
Mhm.
I'm surprised I haven't heard of that one.
I think when maybe if you look it up, you'll be like, "Oh, that movie." It's right there with, like, Groundhog Day. I would put it in that category with the
Yes.
Bill Murray classics.
Yeah.
Yeah, fantastic. Well, it's been a pleasure getting to know you today. Is there anything that we missed that you want, anyone who is considering coming to see you to know about you?
Well, that we offer medical and cosmetic dermatology for patients of all skin types and hair textures, and I think that we can probably help you if you have a skin, hair, or nail problem, and want to come to New York. We also do telemedicine. I have a license in New York State and Connecticut right now, and I'm working on some others. So check in with us if you're watching this at some future date because we may be able to do a telemedicine visit if you can't come to New York.
I will make sure we put the link to your website and all your social media in the show notes. And thank you for joining me today.
Well, thank you. This was fun.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.